If your wife or your girlfriend hasn't wanted sex in months, maybe even years, I need you to hear this. It's probably not because she doesn't love you anymore. It's probably not because you did something wrong. And it is definitely not because you're too old or past your prime. The real reason is something almost nobody talks about in this country. And in the next few minutes, I'm going to walk you through exactly what's happening and what you can do about it starting tonight. I'm Dr. Lily Harper. I've been practicing men's health and urology right here in the States for over 15 years. And in that time, I've sat across from thousands of guys, many of them in their 60s, 70s, even 80s, who come into my office feeling confused, rejected, and honestly a little heartbroken. They love their partner. They want to be close to her. But somewhere along the way, the intimacy just stopped, and nobody ever gave them a straight answer about why. So today, that's exactly what I'm going to do. I'm going to give you the straight answer. No fluff, no lectures, no making you feel like the bad guy. Just real talk from a doctor who's seen this 1,000 times and knows it can get better. Hit that subscribe button and ring the bell, because I post new videos every week on the stuff your regular doctor is too uncomfortable to bring up. All right, let me tell you about a patient of mine. I'll call him Frank. Frank came into my clinic a few months back. He's 67, widowed about 4 years ago, and he finally felt ready to get back out there and start dating. He's a good guy, takes care of himself, walks every morning, still works part-time, and he told me something that really stuck with me. He said, "Doc, I'm going on dates with women my age, and almost every one of them either tells me flat out they're done with sex, or I can just feel that it's an obligation for them. And I don't want to be with somebody who's just tolerating me." Now, Frank wasn't being a jerk about it. He wasn't chasing 30-year-olds or acting like he was still in his 20s. He just wanted a real partnership, including physical intimacy, with a woman in his own age bracket. And he asked me a question I get all the time. He said, "Is this just how it is after a certain age? Do women just stop wanting it?" And here's what I told Frank and what I'm telling all of you right now. No, that is not just how it is. The research is actually pretty clear on this. Yes, hormones shift. Yes, bodies change. But desire does not automatically disappear when a woman hits 60 or 65 or 75. Plenty of women stay sexually active and sexually interested well into their later years. What changes is the frequency and sometimes the way intimacy looks, but the door does not close on its own. Something closes it, and a lot of the time, that something is fixable. So let's get into what's actually going on, because this is where most guys get it wrong, and it's not their fault. Nobody taught us this stuff. Here's the first thing I need everyone watching to understand. A huge percentage of women have spent years, sometimes decades, having sex that didn't feel good. 1 in 4 women regularly experiences pain during intercourse. 1 in 4. Let that sink in for a second. If you're dating a woman who's 60 years old, there's a real chance that for 30 or 40 years of her life, sex was either painful, unsatisfying, or something she did because she thought she was supposed to, not because she wanted to, not because it felt good to her. Now imagine being in her shoes. Would you be excited to get back into something that hurt you or bored you for most of your adult life? Of course not. So when she says she's just not interested anymore, what she's really saying a lot of the time is, "I'm not interested in what sex has been for me up till now." And that is a completely different problem, and it's one you can actually solve. The second thing, and this is the big one that almost nobody talks about on YouTube, is something called vaginal atrophy. I know it sounds clinical and unsexy, but stick with me, because this might be the single most important thing you learn today. After menopause, when estrogen drops, the tissues down there literally start to thin out and shrink. We're talking 50 to 80% of postmenopausal women dealing with this. The skin gets fragile, natural lubrication basically shuts off. And penetration can feel like sandpaper. I mean that almost literally. For her, it's not uncomfortable, it's painful. Sharp pain, burning, sometimes bleeding. Here's the part I want every man watching to hear loud and clear. Lube alone does not fix this. I see guys all the time who think, "Well, I'll just grab some KY, problem solved." That's not how it works. Lube helps, but if the underlying tissue has atrophied, you're putting a Band-Aid on something that needs actual medical treatment. The good news, and this is huge, is that this condition is very treatable. There's a prescription called vaginal estradiol. It comes as a cream, a tablet, or a ring. It goes in locally. It's generally considered safe, even for a lot of women who can't take systemic hormones, and it can literally restore the tissue over a few months. Women who thought sex was over for them come back in for follow-up and tell me it's like getting their body back. I'm not exaggerating. It's one of the most life-changing treatments in my whole practice, and most women have never even heard of it because their doctor never brought it up. So if you're in a relationship with a woman who's pulled away from intimacy, and you love her and she loves you and you want to help, this is the conversation to have, gently and with zero pressure. Hey honey, I read about something that might help if sex has gotten uncomfortable for you. Would you be open to asking your doctor about it? That's it. That's the whole ask. You're not making it about you. You're showing her you noticed, you care, and you want to make it better for her body first. And look, I want to say something here because I know a lot of you are thinking it. I've read the comments on videos like this one. Guys write in and say, Doc, why is it always the man who has to do everything? Why is it my job to fix this? And I hear you. That's a fair thing to feel. So let me be straight with you. This is not all on you. Your partner has responsibility too. She has to be willing to talk to her doctor, willing to try a treatment, willing to meet you halfway. A relationship only works when both people are rowing. But what I can help you with as a doctor who works with men is giving you the knowledge and the language to open the door. Whether she walks through it with you is up to her. If she won't, that tells you something important too. Okay, let's talk about another piece of this puzzle, because pain isn't the only thing that kills desire in long-term relationships. A lot of what I see comes down to years of emotional disconnection, resentment that built up over decades, arguments that never got resolved, kids leaving the house and suddenly you're looking across the dinner table at somebody you haven't actually talked to in 20 years. Bodies change, confidence drops, and she doesn't feel desired anymore because life got busy and nobody made her feel special. And I'll tell you something else that's come up a lot in my practice over the last few years, especially since the pandemic. I had couple after couple come in telling me their intimacy just died in 2020 and never came back. They spent months afraid to touch each other, sleeping in separate rooms, and the habit stuck. If that's you, I want you to know you are absolutely not alone. That's a real pattern I've seen hundreds of times, and it is fixable too. But it takes both of you being willing to rebuild what got lost. Here's what I want guys in long-term relationships to hear. If you haven't been intimate with your wife in a year or 2 years or 5 years, the path back is not through the bedroom, it's through everything else first. Hold her hand while you're watching TV. Bring her coffee the way she likes it without being asked. Sit on the porch with her and actually listen when she talks about her day. Take her out to dinner somewhere other than the same spot you've been going to for 15 years. Make her laugh. I know. Some of you are rolling your eyes right now thinking, Doc, I didn't come here for relationship advice. I came here for medical advice. Fair enough. But I'm telling you, as a physician who has studied this for 15 years, desire in a long-term relationship is not primarily a physical issue after a certain point. It's an emotional one riding on top of a physical one. You fix the physical piece with medical treatment. You fix the emotional piece with consistent, non-sexual affection and showing up. Do both and things start moving. Now let me switch gears and talk to the single guys out there, because Frank wasn't the only one. A lot of you watching are widowed, divorced, or have been single for a long time, and you are back in the dating pool trying to figure out how this works at 60 or 70 or 75. So here's my advice, straight from years of helping guys navigate exactly this. First, have the conversation early. Not on date 1, you don't need to scare anybody off, but definitely within the first few dates. One of the top comments I saw on my last video about this was from a 63-year-old gentleman who said, and I'm paraphrasing, if intimacy matters to you, you need to find out early whether she's interested in that part of life or whether she's looking for a friend. Don't lead each other on. Don't assume it'll just work itself out. Ask. Something like, I'm looking for a real partnership and physical closeness is part of that for me. Is that something you're open to? If she says no, that's not a rejection of you, that's just compatibility. Thank her, move on, find somebody who wants the same thing you want. Second, and this is important, widen the lens on what compatibility looks like. Some women in your age bracket are absolutely still interested in sex and intimacy. I promise you they exist. I see them in my clinic. They want a man who's patient, who communicates, who cares about their pleasure, who doesn't rush. If that's you, you are in demand. Do not let a few rough dates convince you that every woman over 60 has shut the door. That's just not true. Third, for the guys who've told me their own drive has actually gone up in their 40s, 50s, and beyond, and you're worried about finding a partner who can match that, I hear you. That's more common than you'd think. The key for you is honesty about what you're looking for, combined with patience. The woman who matches your energy is out there, but she's not going to be every woman you meet. Be upfront, be kind, and be willing to wait for the right match rather than settling and getting frustrated. All right, now let me give you the practical stuff. This is the part I want you to remember, whether you're married 40 years or dating somebody new. 8 things that make a real difference based on what I've seen work in my practice. Number 1, separate physical closeness from sex in her mind. For a long time, a lot of women have learned that any touch from their partner means he wants sex. So they start flinching away from hugs, from a hand on the back, from cuddling on the couch, because they're preemptively saying no to the thing they think is coming. If you can spend a few weeks just touching her affectionately without it leading anywhere, you rewire that association. She starts trusting touch again. And when touch feels safe, desire has room to come back. Number 2, make her pleasure the goal. Full stop. I'm not saying ignore yourself. I'm saying if you go into intimacy thinking, my job here is to make her feel amazing, and whatever happens for me is a bonus, you will have a better time, and so will she. Women can tell the difference between a man who's focused on her and a man who's focused on himself. It's not subtle. Number 3, talk to her out loud with words. Ask what feels good. Ask what doesn't. Ask what she's been curious about but never said out loud. A lot of women have never been asked these questions in their entire lives. It might take a few tries before she feels comfortable answering honestly, but keep creating the space for it. Number 4, use quality lubricant every single time, no exceptions, even if she thinks she doesn't need it. After menopause, this is non-negotiable. Get a good silicone-based or water-based lube. Don't be cheap about it. This one small change can move sex from uncomfortable to actually nice overnight. Number 5, stretch out foreplay way longer than you think you need to. What used to take 10 minutes in your 30s might need 30 minutes now. And honestly, that's not a bug. That's a feature. Slow is the whole point. Her body needs more time to get ready, and your body, let's be real, benefits from the ramp up too. Number 6, redefine what sex even means. Penetration is one option on a long menu. Oral, manual, mutual touch. Using your hands, using your mouth, trying toys together if she's open to it. All of that is real intimacy. If penetration is painful or not working right now, for whatever reason, you don't have to stop being sexual. You just have to get more creative, and creativity is more fun anyway. Number 7, get any ED issues treated. If you're struggling with erections, please don't just suffer quietly or assume it's part of getting old. There are good treatments now, way better than what was around 20 years ago. And here's the thing, if you're having erection issues and you don't address them, a lot of women blame themselves. They think they're not attractive enough, or they did something wrong. So getting ED treated isn't just about you, it's about taking that weight off her too. Number 8, find positions that actually work for the bodies you have right now, not the bodies you had at 30. If your back hurts, use pillows. If her hips are stiff, try side-lying positions. Use the edge of the bed, use a chair, use a wedge pillow. There are tools out there specifically designed for couples in their 60s, 70s, and beyond to make intimacy comfortable again. Putting in a little planning so nobody's in pain turns sex from a chore back into something to look forward to. I want to wrap up with one more thing, because I think it's the most important point of all. Whether you're single and dating or married for 45 years, the women in your life who seem uninterested in sex are almost never actually uninterested in sex. They're uninterested in sex the way they've experienced it so far. Painful sex, obligatory sex, sex where nobody asked what she wanted, sex that was over before anything good happened for her. If you can show her something different, something where her comfort comes first, her pleasure matters, her body is respected and cared for medically, and there's zero pressure to perform on any timeline, a lot of women you thought were done with sex turn out to just be done with what sex used to be. Give her a reason to try again. Give her a safe space to rediscover what her body can feel and get her proper medical care for anything that's physically getting in the way. I've seen this happen in my clinic over and over for 15 years. Couples who thought they were done, who came in almost ready to give up, and a year later they're back in my office telling me they feel like they're dating again. I've seen widowers in their 70s meet a woman, do this the right way from date one, and build something better than what they had in their first marriage. It is possible. Do not let anybody tell you different. So if you're watching this and you're in that place, whether you're trying to reconnect with a partner you've been with for decades, or you're back out there meeting new people at 68 like Frank, I want you to know a few things. You are not too old. You are not past your prime. Your desire is not something to be ashamed of. And the woman for you, the one who still wants this kind of connection, she exists. Your job is to become the kind of man who creates the conditions where desire can actually grow, and then to be patient enough to let it. If this video hit home for you, do me a favor and hit that like button. It really helps other guys find this channel. Drop a comment and tell me your situation. Are you single and dating, married a long time and trying to find your way back, widowed and figuring out what's next? I read every single comment and I use them to decide what to make videos about. If you want me to do a deeper dive on vaginal atrophy and how to bring it up with your partner, or a full video just on dating after 65, let me know in the comments and I'll put it in the queue. And please share this with a buddy. I know guys don't talk about this stuff with each other, but maybe you've got a friend who's been quiet lately, or a brother who lost his wife, or a neighbor who just got divorced. This conversation could change something for them. Take care of yourselves, take care of the people you love, and I'll see you in the next one.